Good day everyone, my name is Angela Salili, your student nurse for today. And now, I'm going to perform the step-by-step process of starting an intravenous infusion.
First is to check the doctor's order and make an intravenous label. Wash hands. Gather all equipment and prepare the IV solution and tubing.
So when opening sterile package and IV solution, maintain the aseptic technique. So in preparing IV tubing, clamp the tubing, then uncap the spike and insert it into the entry site on the bag or the bottle as the manufacturer directs. If an additive is ordered, incorporate it before entering the spike into the entry site.
Suspend the IV solution on a hook in the preparation area and press the drip chamber and allow it fill at least halfway.
So next is to remove the cup at the end of the tubing. Then release the clamp and allow the fluid to move through the tubing. Allow fluid to flow until all air bubbles have disappeared. Then after it, close the clamp and then recap the end of the tubing, maintaining sterility of the setup.
Notify the physician or nurse who will insert the IV. When he/she arrives, bring preparation to the bedside.
In the next procedure, I'm going to identify the client and explain the procedure. So, ma'am, ito yung pangalan, ma'am. Sahaya Benza. Okay. So, karon ma'am, magtaod ko swero sa imong kamukha. Taylor.
Have the client in a supine or low faller's position in bed. Suspend the bag or bottle of solution on the IV stand. When starting the procedure, put on the tourniquet. It should be followed by a cotton ball with alcohol. Then insert the needle or Vasican. Release the tourniquet when return flow of blood is observed. Connect the tubing to the needle. Start the flow of solution promptly by releasing the clamp on the tubing. Support the needle with a small piece of gauze or tissue paper under the hub. Loop the tubing near the site of the entry and anchor it with plaster to prevent pulling off the needle. Adjust the rate of flow according to the doctor's order. Do the aftercare of the equipment and wash hands. Document the procedure and the client's response. Chart the time, site, device used, solution and rate of flow, and the physician, nurse who inserted the needle. Monitor periodically at least every 30 minutes to check flow rate and observe for infiltration and other untoward symptoms.
And now I'm going to perform the step-by-step process of regulating intravenous flow rate.
First, check the written medical order.
The next, identify the drip factor on the IV tubing package.
Calculate correctly the rate of drops per minute. Then check the patency of the IV line and needle. Count the number of drops flowing into the drip chamber for 1 full minute.
Next is to release the roller clamp until the calculated rate is infusing.
Monitor the IV flow rate at frequent intervals. Document the type of infusion, amount, flow rate, and client's response to the prescribed infusion rate. And now I'm going to perform the step-by-step process of discontinuing intravenous infusion. Check the physician's order for discontinuing intravenous fluid. Wash hands and assemble equipment.
Now, I'm going to identify the client and explain the procedure. So, ma'am, ano yung pangalan? Kahanan. So, karon ma'am, tanggalon na ako ang serum nimo ha. Okay, nurse.
Release and courage of arm, tubing, and needle. Loosen the tape at the venipuncture site while holding the needle firmly and applying counter traction to the skin. Hold a swab above the venipuncture site. Withdraw the needle quickly by pulling it out along the line of the vein. Immediately apply firm pressure to the site using the swab for 2 to 3 minutes. Hold the client's arm if any bleeding persists. Apply the dry cotton balls band-aid to cover the IV site. The next, check the needle or catheter to make sure it is intact. It is well intact. Discard used supplies appropriately. Remove gloves and wash hands. Record the amount of fluid infused on the I&O record sheet and on the chart. Include the type of solution used, time, and reason for discontinuing the infusion and the client's response.